And I'm John McGrath. I'm a consultant urologist based in Exeter, where I've been for 15 or 16 years. I currently work as the national co-lead for GERF Urology. That's the Getting It Right First Time programme at NHS England. And I've had a career-long interest in improving and delivering the care for patients diagnosed with bladder cancer. Originally, that was through doing the more major surgery and introducing robotic program into Exeter. Then following a period off work myself, I came back in a rather different form, and I focus on the diagnostics and the higher volume but lower complexity, the transurethral resection of tumours, which again is what most patients will experience, is that diagnostic and treatment pathway, and trying to influence that locally and in my national role as well. So over the last 15, 16 years, I'll have been involved in the care of what must be thousands of patients diagnosed and living with bladder cancer, many of whom we get to know well because of the current nature of the disease, and so multiple contacts during that time as well. The advice I would give to patients who think they've got a symptom of bladder cancer, and in the majority of cases, but not always, that will be blood in the urine, is to seek urgent medical advice. That's normally through your GP to begin with, and to seek then an urgent referral to urology units so that we can get investigations in. We know currently that some patients are delayed both in being referred from the GP, from primary care, or delayed in getting the treatment, the investigations they need within secondary care, i.e. hospitals. So I think it's about making sure that your symptoms are taken seriously, you get that urgent referral, and then that the investigations are undertaken promptly once referred to see someone like myself or a colleague within the urology department. I would suggest, in terms of getting advice if you are diagnosed with bladder cancer, the absolute gold standard of care is that you would meet one of the nurse specialists, the CNS, at that point of diagnosis. That would be what we would aim for. And at that time, you just have had a procedure done. You may be feeling rather daunted by it. So it's very important as a patient that you really arm yourself with as much information as you can about your condition, but also the local services that are available. And I think it's entirely appropriate to ask what those are, to ask what experience the departments have, what services they offer, to ensure that you get offered the full range and the correct treatment. What I hope for in the future is that we make some progress in the treatment and the outcomes for patients with bladder cancer. Actually, things have been very static for 20 to 30 years in terms of what is on offer and how patients can expect their care to be delivered, and the likelihood of the disease recurring or the disease progressing to a more advanced form, and we need to change that. So I think we are seeing more investment in research. I think we're seeing greater clinical interest. I'm absolutely delighted to see that we've got patient advocacy and support groups and lobbying. And I think that's now the combination that we need to try and drive increased research, increased funding. And I think there's stuff we can do right now without more money. We just need to look at some of the processes that are at the moment perhaps too slow. The services aren't comprehensive enough. Maybe isn't someone in that unit with a specialist interest in bladder cancer. We can actually improve the quality very quickly through the GERF program would be one way of doing it. I know there are other groups working on that as well, but then with a longer term ambition that we must work to improve outcomes. We must do that in parallel with patients whose experience it is to live with bladder cancer and to undergo those treatments.